Welcome everyone, my name is Yi, and I'm your host for Occupational Medicine Pearls podcast. I'm glad that you are joining me today for this episode because we will be diving into one of the most consequential chemicals in our field, benzene. Let's have a look. Benzene is a clear, colorless, highly flammable liquid, and it has a unmistakable sweet petroleum odor. Benzene has been both an industrial workhorse and a long-recognized carcinogen, unfortunately. Hence, under Australian Work Health and Safety Regulation, its usage has been restricted. So where do we find benzene? So benzene is an aromatic hydrocarbon naturally present in crude oil and refined petroleum. It also used as a solvent in manufacturing, paints, varnishes, liquid thinners, and gasoline. In Australia, the workplace exposure standard is 8-hour TWA of 1 ppm or 3.2 mg per cubic meter. Work activities that require particular attention include refining operations, for example, maintenance or assembling of benzene-containing refinery streams, chemical manufacturing, handling, storage, and transport of petrol. Example, filling rail or road tankers, motor vehicle repair, especially working on fuel systems, plastic and rubber manufacturing, steel production, during which there could be exposure to coal and coke products, and finally, firefighting, particularly when burning synthetic polymers like PVC or urethane foams. There are also sources of non-occupational exposure. Benzene, together with other aromatic hydrocarbons such as toluene, ether benzene, and xylene, form a major component of petrol. Benzene can escape into the air, particularly from vehicle fuel systems and from fuel stations. The major source of exposure for general population is from the vehicle exhaust. Benzene exposure has also been recognized as a potential risk in coal seam gas industry, particularly where fracking is being undertaken. Cigarette smoke contains benzene, and the World Health Organization has estimated benzene intake of 30 micrograms per each cigarette. Passive smoking, particularly indoors, will also contribute to benzene intake of non-smokers. As usual, we will look back to our human's timeline to see the role of benzene in the occupational medicine. Benzene's toxic legacy is one of the earliest recognized in occupational medicine. By the 1920s, clinicians in Europe and the United States were reporting cases of aplastic anemia in workers exposed to benzene in rubber, painting, and shoe manufacturing businesses. Italian physician Giulio Vigiliani was among the first to systematically link benzene to bone marrow failure. By the 60s and 70s, due to the help of large epidemiological studies, particularly from China and US, confirmed that benzene's association with acute myeloid leukemia. These historical findings help shape today's modern industrial hygiene, biological monitoring processes, and regulatory framework. After the history lesson, we will look at pre-placement medical assessments. If we are assessing a worker for work that will have potential exposure to benzene, we need to go over their previous medical history, employment history, smoking, any history of allergies and sensitization. Respiratory system and bone hematopoietic system should be focused on the physical examination. There should be biological samples taken from blood and urine. For blood, we will need to assess full blood count, and from urine, we will need to measure S-phenyl mercapturic acid, or SPMA for short, as a baseline. Once a worker had been working in the industry, we will need to perform health surveillance. For that, we also need to know the exposure pathway with the benzene gas and vapors. Inhalation is the primary method, and they can also contact from the skin as well, but accidental ingestion are rare. S-phenyl mercapturic acid and trans muconic acid TTMA are two minor urinary metabolites. SPMA is highly specific marker for benzene exposure. Urinary SPMA should be collected at the end of the shift and at the end of the week. This result will reflect exposure level over the previous few days. Half-life is 9 hours, so that's why the window of sample collection is important. And urinary SPMA should be below 11.8 micromole per mole creatinine. Other level we can assess is blood benzene level. It can be used as an indicator for benzene exposure. The half-life of benzene in the blood is short, only about 30 minutes, so sampling time is crucial, and sampling immediately at the end of exposure is preferable. It could be used as a confirmatory test for benzene exposure at work. After understanding about monitoring, I want to cover about metabolism, since that is important to understand toxicology. Benzene itself is not the primary agent of harm, similar to other chemical agents. The real toxicity emerges through hepatic metabolism, particularly through cytochrome P450 EAA enzyme system. So CYP2E8 oxidized benzene into benzene oxide, and then it converted itself into phenol, catechol, and finally hydroquinone, which is a dangerous chemical. In the bone marrow, these metabolites undergo secondary activation into benzoquinone, which is highly reactive species that can damage DNA, proteins, and hematopoietic stem cells. Unfortunately, bone marrow also contains many cells that are very much vulnerable, and this metabolic cascade explains why benzene is both hematotoxic and leukemogenic, and even low-level chronic exposure can be clinically significant. After metabolism, we will cover the health effects, which include acute and chronic as usual. The effects of benzene in acute state is fairly dependent on the dose. If we start with 20,000 ppm, and even exposure to that level, 5 to 10 minutes could be fatal. It will cause massive pulmonary edema and respiratory arrest, followed by death. However, if it is lower, symptoms are less severe, it would affect both the central nervous system and respiratory system. It can cause depression of central nervous system, so unconsciousness, narcosis, coma, and death could happen. But if it is milder, you may see euphoria, speech, dizziness, nausea, vomiting, and headache, or incoordination. In the respiratory system, similar to all other solvents, they're gonna irritate respiratory tract to some degree, depending on the concentration and the duration of exposure. Respiratory tract irritation usually confined to upper airways, including the nose and sinuses. So if the symptoms are milder or exposure is low, there may be sore throat and nose, cough, and possibly chest pain. After acute, we need to look at the chronic effects. Benzene is both hematotoxic and leukemogenic, as mentioned before, and chronic exposure to levels of 100 to 500 ppm had resulted in bone marrow depression, leading to anemia, leukopenia, thrombocytopenia, and pancytopenia. For the bone marrow depression, the lowest observed adverse effect in human is 7.6 ppm. So that's very low dose, low level of concentration. Other chronic effects may include personality change, fatigue, impaired concentration stemming from depression of central nervous system, irritant dermatitis, hepatocellular injury, and proximal tubular damage in the kidneys. We will also need to know the carcinogenicity, hematologic neoplasms such as acute myeloid leukemia has been documented to occur with chronic exposure as low as 10 ppm of benzene. Several reports suggest that exposure to benzene may also be related to non-Hodgkin lymphoma and multiple myeloma. If I have to summarize, benzene is an aromatic hydrocarbon that are found in many different industries, and its effects seem to be able to cause problem even at the low dose chronic exposure. And that's why the monitoring through the health surveillance are important to detect early changes of the hematological problems. It has sensitive urinary and blood tests available, so we better use that, and we should have a high level of vigilance when we are doing health assessments for these workers. That is for today's episode about benzene of our Occupational Medicine Pearls podcast. If you found this useful, please share it with your colleague, especially anyone who is involved with health monitoring or workplace assessment. I'm Yi, and see you next time.